Dr. Vargas, can we help patients with macular degeneration with stem cell therapy?
Macular degeneration is one of the most successfully treated diseases by the use of stem cells. We have a lot of experience in this, and throughout the years we have observed a very good response, I would say, if not all, in almost 100% of the cases. The reason why it responds satisfactorily is because the neurons actually in the retina, these are neurons, very simple neurons, are very ancient. They only have, if you want to call it that way, 1 foot. So that's a very simple neuron that has existed for a long, long time, processing the light into electrical pulses that will feed the brain and form an image. These cells are likely to be affected by mostly vascular conditions, such as the case of diabetes, but also in the case of autoimmune diseases, and some others, for example, affecting certain parts of the retina. The one in this case is the affectation of a central part of the retina called the macula, where you focus what you're reading. So typically these people cannot read anymore. They can see images around, they can see movement, but they cannot focus their sights in an object, or much less into reading. They affect the cones. The cones is a special type of retinal cell that is designed, for visual acuity. So the treatment with stem cells will greatly influence these cells, because the more ancient and the more simple the neuron is, the easier it is to affect it, either positive or negatively. For example, in this case, if you're going to stimulate the function or reinstigate the normal function of the retinal cells, it's much easier than if you're going to attempt to do that with an upper neuron, which is a lot more complicated. And this is why over 90% of the patients get very good results, very positive results, as far as regaining their visual capacity through the stem cells. And that happens very fast, usually within just a few days. So it is one of the most successfully treated diseases with stem cells.